And indeed, we must remember, in the last 36 hours, 1,769 people have suffered the indignity just in the last 36 hours of being seen in an emergency department, been deemed sick, in need of a hospital admission, in need of further care, and they've continued to be looked after on chairs, on trolleys, in overcrowded conditions within emergency departments, which is not conducive to the delivery of self-care. And I think the key thing our members are saying, they feel abandoned and let down by the government and by the HSE. As Ronan pointed out there, this was completely predictable. There's nothing happening now at the moment that wasn't predicted. There's a high number of viruses circulating, predicted. There's unprecedented presentations, predicted. I've heard government ministers talk today about we've recruited 16,500 additional staff, but have completely left out the context that only really brought us back to the staffing levels we had back in 2008. And the population and the demand for the service has grown significantly since then. So our members, nurses working in emergency departments tonight, Ciara, are sick to death of hearing the government and the HSE commentate on the problem. What they need to hear from the government and from the HSE is what the immediate solutions they're going to put in place tonight and tomorrow for the next 2 weeks to alleviate the stress and problems that they're dealing with. It's dangerous for patients within emergency departments. But one thing that's distressing to me, and I spoke to my father this morning, who said he'd never go near a hospital based on all the stories he's hearing in the media. Now, he's fit and healthy and he's in his 70s. But the reality is this, that there are people at home that are sick, that may be having a stroke, having a heart attack, have a broken leg, that are thinking twice about going to our hospitals. That's not good enough. And they're hearing that because the HSE and the government are saying avoid emergency departments. Go to your GP. Where there's a lack of GPs and a lack of practice nurses, we need to actually double the number of practice nurses currently working within the system. Go to pharmacies. That won't solve a heart attack, an appendicitis, a cholecystitis, whatever it is. So there are people that are genuinely sick that need hospital care, and they're being frightened off attending emergency departments because of the current situation.
Yeah, and it must be very difficult too, sorry to only cut across you, for your members, because members of the public who are attending hospitals are probably feeling scared, frustrated, and they must be venting a lot of that on your members.
Absolutely, and we see a massive increase in assault on nurses. And no doubt, this is a powder keg environment. You have people that in emergency departments, so Beaumont was referenced there, and indeed I worked in Beaumont many years ago as an emergency department nurse, and I know that department well. The reality is that they will see 180 to 200 patients per day. 70 to 75% of those patients will be seen, treated, and will be discharged home. But it's the 25 to 30% that need a hospital bed that have a difficulty getting to that bed. And then, this is not, Beaumont is one of the better performers with regards to patient flow. But the reality is that these patients end up in an emergency department, being wheeled out of cubicles, back into cubicles. There's no continuity with regards to care. They're moved around all the time, and it's a dangerous environment for those patients.
Okay, I just want to put some of this, sorry, Tony, to cut across you there.
Is that the Minister has never had a better opportunity at Cabinet. He has 3 former Ministers for Health within the Cabinet, 2 of them holding the most senior positions of Taoiseach and Tánasite. They need to devise a capital infrastructure plan to build 5,000 additional beds immediately, and they need to come up with a workforce plan to ensure that we have nurses and doctors and other healthcare professionals to deal with the current crisis that exists.